Fatty liver disease is arguably the most common liver disease in the world, affecting about 1 in 4 people globally. If left untreated, fatty liver disease can lead to serious health problems, including nutritional deficiencies, liver cirrhosis, liver failure, and metabolic syndrome, which itself is a major risk factor for many chronic conditions, including high blood pressure, insulin resistance, type 2 diabetes, heart attacks, and strokes. But is that possible to detox your fatty liver without medications? Let's find out in today's video. We'll also learn about some interesting facts and stats about fatty liver disease with some quick tips on how to reduce fat from the liver. So let's get started. First, let's see what fatty liver disease actually is. Fatty liver disease is a condition where too much fat accumulates in the liver. This fat buildup can lead to liver inflammation, liver cirrhosis, in which liver tissues are severely damaged, liver failure, and sometimes even liver cancer. There are basically 2 types of fatty liver disease. One is non-alcoholic fatty liver disease, which is the most common type. It initially starts with fat buildup with minimal inflammation or liver damage. But if not treated, it can lead to more severe inflammation and liver cell damage, increasing the risk of liver fibrosis. Another type is alcoholic fatty liver disease, which is caused by excessive alcohol consumption, leading to fat accumulation and liver damage. Fatty liver disease often presents with no specific symptoms, making it a silent condition. Some common symptoms include fatigue, abdominal pain, digestive issues, and others that most people usually ignore. So the only way to be sure if you have a fatty liver is getting yourself checked and conducting liver function tests. The good news is, there are actually some simple steps that can completely reverse fatty liver, particularly if you stay consistent and combine them with your ongoing treatment. The primary and most common culprit behind a fatty liver, which is the most common kind of fatty liver, is sugar, particularly glucose and fructose. When you take too much sugar, whether it's in the form of table sugar, added sugars, refined carbs, or starchy foods, it causes your blood sugar levels to spike. To control these surges, the body releases insulin, a hormone that causes cells to absorb sugar for energy. If cells are already full of sugar, or there's not much insulin, or if you have insulin resistance, this excess sugar goes into the liver, which converts it into a type of fat called triglycerides. This fat coats the liver and gradually leads to fatty liver disease. This excess fat doesn't just linger on in the liver, it spills down to the abdominal area, increasing waist circumference. So, if you have more fat in your belly, you are very likely to have a fatty liver too. In fact, studies show that over 60 to 80% of obese individuals have some degree of fatty liver disease, with the risk increasing with the severity of obesity. When you eat too many processed foods and sugary drinks, you might overload the liver with fructose. Fructose, in turn, goes straight to fat production and ultimately coats the liver with fat. This overload gradually leads to fatty liver disease. So it is crucial to protect your liver from fructose overload. You might find fructose in sweetened beverages, sodas, sports drinks, juice boxes, fruit drinks, frozen dinners, ready-made meals, condiments, dressings, breakfast cereals, baked goods, desserts, candy, chocolate bars, yogurt with added sugars, canned fruits, and many others. But remember that this list is not exhaustive, and reading food labels is crucial to identify hidden sources of fructose. Similarly, some common sources of glucose to be mindful of are white bread, pasta, rice, potatoes, white flour pancakes and waffles, fruit juices, energy drinks, coffee creamers, and sweetened coffee drinks. Now, let's learn about some of the best ways to lower fat around the liver. Number 1. Intermittent fasting. Intermittent fasting essentially prevents you from overeating. This limits the total calorie and sugar intake, including glucose and fructose. A 2019 study found that 16-hour daily fasting led to a 24% decrease in overall calorie intake in overweight people. Another 2020 study reported that a 12 to 24-hour fasting window consistently reduced total calorie and fructose intake by up to 35%. Since overweight and obesity are major risk factors for fatty liver, intermittent fasting can be extremely effective for weight loss, which in turn can reduce liver fat. Moreover, fatty liver is often associated with insulin resistance. Intermittent fasting can help improve insulin sensitivity, which means your body can utilize available sugars and burn stored fats more efficiently, both of which can reduce fat in the liver. In fact, a 2023 study found that intermittent fasting reduced liver fat by 24.7% in people with non-alcoholic fatty liver disease compared to control groups. Number 2. Low-carb diet. Being on a low-carb diet means significantly reducing your intake of carbohydrates, typically to less than 50 to 150 grams per day. This can lead to various metabolic changes that may be extremely beneficial for managing fatty liver disease. When there's not much sugar around, the liver switches from using sugar to using stored fats for energy. This can prevent the liver from making new fat from carbs or sugars. Eating less carbs can also make the body better at using insulin, helping to control blood sugar and preventing extra sugar from turning into fat in the liver. A 2020 study found that low-carb diets led to an average weight loss of more than 11 pounds in obese individuals as compared to control groups. And a 2018 study showed a 23% improvement in insulin sensitivity with a low-carb diet compared to a low-fat diet in fatty liver patients. Number 3. Avoid processed or packaged foods. Avoiding processed or packaged foods may be very effective in managing fatty liver disease, particularly non-alcoholic fatty liver disease. Processed foods often contain lots of added sugars and saturated fats, both of which can increase fat buildup in the liver. Limiting these ingredients essentially reduces the liver's workload and causes fat breakdown. Also, many processed foods use refined carbohydrates like white bread and pasta. This leads to blood sugar spikes and increased insulin resistance. This, in turn, triggers fat storage in the liver. But remember that simply avoiding processed and packaged foods isn't a cure for a fatty liver, especially if it's already in advanced stages. But it can effectively help you manage the condition and probably even reverse it if you stay consistent. Always consult your doctor for proper treatment and personalized guidelines according to your individual condition. Number 4. Combine a low-carb diet with intermittent fasting. A 2020 study found that 50 participants who followed a combination of a low-carb ketogenic diet and alternate day fasting for 12 weeks experienced significant reductions in liver fat compared to those who followed either fasting or a low-carb diet alone. The study found that the combination group lost around 10% of their body weight and reduced their liver fat content by an average of 49%. They also showed improvements in blood sugar control and insulin sensitivity. However, it is important to talk to your doctor before starting any new diet plan or going on a restricted diet, especially if you have any underlying health conditions. Start slowly and gradually increase the duration of your fasts and the restriction of your carbohydrate intake. Also, make sure you're getting enough nutrients by eating a variety of whole foods. Make sure to like this video and subscribe to the channel to support our mission to help improve your health. Thanks for watching and see you in the next video.